Hello, I'm Myra DeLuca, a certified nurse midwife and PhD student at Penn State University, and this poster presents a narrative review on interprofessional collaboration between midwives and physicians in U.S. hospital-based maternity care systems. Interprofessional collaboration occurs when two or more autonomous professionals work together towards achieving a shared system-level or patient-centered goal, and it is often cited as an essential tool to improving maternity care. Prior work suggests that when midwives and physicians collaborate effectively, we see increased access to maternity care services, improved care outcomes, and more efficient use of limited healthcare resources. However, it's not always clear how collaboration is defined, demonstrated, or operationalized in the literature. So the purpose of this review was to examine how interprofessional collaboration between midwives and physicians was described in recent U.S. literature with the goal of identifying key themes and revealing research gaps. This review was conducted with support from an allied health librarian. We searched PubMed, CINAHL, PsycInfo, and Scopus using keywords related to interprofessional collaboration, midwifery, and obstetrics, and an analysis was conducted using Miles and Huberman's inductive thematic synthesis approach. You can see our inclusion and exclusion criteria listed. We included empirical studies and professional guidelines published in English over the last 10 years, focused specifically on collaboration between certified nurse midwives or certified midwives and OBGYN physicians in U.S. hospital-based settings. We did not include sources focusing on other types of providers such as family physicians or non-CNMCM midwives. Likewise, we did not include sources focusing on out-of-hospital birth settings or gray literature. 14 articles met inclusion criteria. If you're interested in the Prisma flow sheet, you can scan the QR code there and see that. In the middle, you can see the themes. 5 consistent themes emerged across the literature. First, aligning roles and expectations. Clear clinical roles, shared goals, and structured clinical protocols were foundational for collaboration. And strong leadership made up of both midwives and physicians was essential. Second, behaviors that built collaboration included mutual respect, professional autonomy, frequent communication, and face-to-face interaction. Third, navigating barriers emerged as a key theme. The literature showed that misunderstandings of professional roles, institutional hierarchies, and unsupported practice environments were all barriers to interprofessional collaboration. Fourth, the included studies highlighted that understanding the role of interprofessional education, including shared training experiences, were described as critical for building trust and collaboration over time. And finally, experiencing the benefits included improved team functioning, smoother care transition, and expanded patient care options. In conclusion, what we found when looking at all of the sources was that interprofessional collaboration is consistently described as relational and context dependent, with benefits for both physicians, midwives, and patients. Yet notable gaps remain in the evidence linking collaboration directly to patient-level outcomes. Importantly, the implications reinforce the importance of professional autonomy, role clarity, and shared accountability in practice. While in policy, restrictive regulations and reimbursement inequities continue to undermine collaboration, and there emerged a strong need in further research that is longitudinal and outcome-focused. Validated measures of interprofessional collaboration in maternity care are also needed. Thank you, and I'm happy to answer any questions or talk more about where this research is heading next.